Okay, so today we are talking about oxygen therapy. Oxygen saturation, the normal O2 sat is 95 to 100%. If the patient presents with shortness of breath or dyspnea with exertion, the O2 sat can be altered, and this patient would be placed on a pulse oximeter. And you can see here this picture, the one clips right on the patient's finger. If you do not get a good reading on the patient's finger, they do have pulse oximeters that can be applied to the patient's earlobe. And also the pulse oximeter, the one that goes on the finger, can be placed on the patient's toe if you're not getting a good reading. But anyway, these devices read the oxygen in the blood and demonstrate the heart rate. So American Heart Association guidelines recommend that when oxygen saturation drops below 94%, we place the patient on oxygen. And this guideline did change from a few years ago. It used to be 92%. So it is now 94%. So when the oxygen sat drops below 94%, we place the patient on supplemental oxygen. So nasal cannula is a low flow device, and we typically begin at 1 to 2 liters per minute and increase by 1 liter per minute increments as indicated by the physician. So you can see the nasal cannula here. The two little prongs here just fit comfortably inside the patient's nose, and then the cable wraps behind the patient's ears. And you just want to make sure it's comfortable, and when you move the patient, you want to make sure that cable, the tubing, is not pulling on the patient's nose. So again, the nasal cannula is a low flow device, and that is what we would initially use if the patient's sat drops below 94%. A non-rebreather mask has a one-way valve that prevents exhaled air from entering the reservoir bag that's right here connected to the mask. This prevents patients from breathing room air, but allows exhaled air to breathe out. So usually the patient receives between 6 and 10 liters per minute of oxygen with this type of device. The simple face mask is used to deliver low flow oxygen to the patient. It is placed over the patient's nose and mouth and delivers approximately 5 liters per minute of oxygen to the patient. So the side holes, which are located right here on either side of the mask, allow the room air to exit and enter. The bag valve mask is connected to a continuous flow of oxygen and is delivered to the patient by the operator squeezing the bag. So you can see in this picture here, the operator is squeezing the bag here, and it is connected to a continuous flow of oxygen, which is usually turned all the way up to 15 liters per minute. So this is a high flow device. The oropharyngeal airway is designed to be an S shape that holds the tongue away from the pharynx. This device keeps the airway open during bag mask ventilation if it is needed for the patient. So this just shows you a picture of the device and how it is placed in the patient's mouth. And then the endotracheal tube. These last two slides are just FYI, just to show you different pictures of the ET tubes that are used. And again, this is for patients who need to be intubated, need to be connected to continuous flow of oxygen, and this is used for severe hypoxia. So again, these last two slides are just FYI. And the big items that I want you to remember is the difference between a low flow device and a high flow device for the quiz.